Welcome back. Good to have you online. As always, you're watching Ozarks Tonight. I'm David Oliver. Last month, we introduced a new series of segments to you that we're going to be bringing you all year throughout 2020 here on Ozarks Tonight. It's from the American Academy of Ophthalmologists. They've developed these eye health awareness topics for the year of 2020. It's kind of appropriate to let you know more about different eye health issues each month throughout the year. Last month, we talked about glaucoma awareness. That's on our website at ozarksfirst.com. This month, we're going to talk about, and this is a mouthful, age-related macular degeneration. I've got Dr. Shachar Tauber back once again from Mercy. He is an ophthalmologist, an eye surgeon, and a head of the Mercy Specialty Eye Care Program in a 4-state region. Dr. Tauber, good to see you again.
Great to see you, David.
Last month you told me I could abbreviate this. What did you tell me it was?
ARMD.
Okay, tell me about age-related macular degeneration. The last time I'm going to say that, ARMD.
ARMD is a disease affecting our seniors, mostly age-related, and it is a loss of the central vision. It can come on gradually where things look distorted. So if I'm looking at a straight line, like a column or a door, it'll have distortions to it, or it'll have spots missing in it. Or it can come on extremely fast, where the vision suddenly disappears because it's bleeding. So we call it wet and dry. The dry is slow, the wet comes on suddenly. And it really can be devastating and limit patients' ability to read, drive, and be independent.
And this is a leading cause of blindness in Americans too, and everyone else around the world.
It is one of those diseases that has changed over the years from a sentence of blindness to something right now that is revolutionized. In the time I've been here in Springfield, dramatically changed our treatments, and new research is showing ability to treat even other parts of age-related macular degeneration that to this day we don't have treatments for.
What are the treatments, and again, let our viewers know too what they should be looking for in terms of, okay, I think I may have an issue with this, I should probably see my eye doctor.
We should have our seniors have an annual eye exam. That is something that should be seen because sometimes it's very subtle. Even my mother went in for her eye exam and found very mild dry-related macular degeneration. So in an eye exam, just like glaucoma last month, it can kind of suddenly, and that's the patient you want. Because that patient, you can talk to them about diet. You could talk to them about cessation of smoking. So you want the leafy vegetables, you want the blueberries and magnesium, and you don't want to smoke. And if you can take care of those issues for the patients, and there's vitamins that can be used that are available over the counter that are very good and help these patients prevent this from progressing. And you also want to let the patient know that there's certain signs that you need to call immediately to our office, and any office, 24/7 will always have someone available to answer the question and get the patient in quickly. The idea of the wet one frightens most people because they seem to know friends and family who have suddenly woken up blind and have the macular degeneration. We now have, since I've been here, changed the face of this disease throughout this country, throughout the world, by simply putting medicine in the eye, sometimes as frequently as 4 weeks, sometimes as rare as every 4 months. But that has changed from what was a disease that caused 15 years ago 90% blindness to 10 years of no blindness with this treatment. So someone 15 years ago would be blind in 10 years. Someone who gets treatment now has 90% chance of seeing 10 years from now.
That's amazing.
We don't have that anywhere in medicine.
Yeah, I was going to say, I had a great-grandmother. She's been long passed away, but she lived most of her life with about 80% blindness. I don't know if this is what caused it, but you think about people in your life who you've known who've experienced some kind of a vision loss, perhaps related to this or some other condition, and the fact that you can now help those people, whereas before it was just a sentence you lived with.
Yes. It really is something to see that you can take these patients and they come in and it is an infusion, if you will, to basically preserve the vision. And some of these patients are returning vision back, which is phenomenal. Some of the work we've done here, pioneering work, is included some medication that is now routine, has been done with our doctors at Mercy and is used throughout the whole city.
Okay,
right now.
So a lot of obvious advancements there. And if you want to leave folks with one thought today about age-related macular degeneration, I'm going to say it slow every time, what's that one thought you'd like to leave them with today?
Don't be frightened of that word or that term and have an eye exam.
Okay, just go see your eye doctor.
Yes.
Simple as that. And if you'd like to know more about age-related macular degeneration, which I'm going to say slow every time, you can find more at the American Academy of Ophthalmologists website, aao.org. You can find out more about Dr. Tauber and his practice at mercy.net. Dr. Tauber, good to have you here. And next month, the eye health topic, or the eye health awareness topic from the American Academy of Ophthalmologists is workplace eye wellness. So we'll tackle that one next month.
Very important one to talk about.
Yeah, it's very important. We use our eyes. I have to use my eyes every day to do my job. So.
And they're very precious.
Well, I appreciate that. Thanks for being here once again. We'll have more Ozarks tonight after this quick break.